James.
Hello.
How are you doing?
I'm doing good.
Good. Welcome to the office.
Thank you.
So it looks like you're in for an in-depth scalp exam today. I read that you're having some issues with dandruff and dryness.
Absolutely. My hair has been pretty dry lately. Having some more flakes than usual. A little bit of itchiness as well. I've been scratching it.
Okay, so you've been scratching your scalp.
Yes.
Okay. And then I also saw that you're due for your annual skin exam, so we're going to go ahead and get that taken care of for you today as well.
Okay.
I do want to go ahead and start with the scalp exam.
All right.
So allow me to just put on a pair of gloves. I am going to be applying sterile gloves today, just in case we come in contact with any sort of dermatitis or signs of infestation.
Okay.
I'm just going to place this on your chest for a second, if that's all right.
That's fine.
Okay, so let's go ahead and get started with just kind of a visual inspection. I just want to get an idea
Okay.
of the state of your scalp. So I'm going to be taking my pen light and just have a regular kind of cotton tip applicator that will help me separate some of your hair. So just having a look at your hairline. And is there a certain area where you notice dryness, or is it just kind of all over your head?
It's mostly all over, I guess, the top and towards the back.
Okay, so like around your hairline and then maybe towards the nape of your neck.
Yes.
Okay. And have you recently come in contact with anyone who has any sort of infestation, whether it be lice or mites?
No, I haven't.
Okay. Okay. So far I am seeing just some slight flaking, which would indicate the dandruff. You already suspected that, so you are correct. Do you typically use a dandruff shampoo?
I haven't. I had one a while ago, but I haven't been using it after it ran out. I didn't replace it. I just got a regular one.
Okay, so just been using a regular shampoo recently. Do you condition your hair?
Yes, I do.
Okay. And how frequently would you say you wash your hair?
Every few days.
Okay. 1 to twice a week about?
Yeah.
Okay. So that's a good amount of time. You definitely don't want to overwash it. Essentially, dandruff is a reaction to bacteria you already have on your scalp. So it's a naturally occurring bacteria that everyone has, but not everyone has the reaction to it. So the dandruff is your body basically trying to fight off that bacteria. You don't want to overwash your hair because then you're at risk for drying your scalp out even further. But obviously you want to be washing it at least once a week so that you're maintaining a healthy environment for your scalp.
Okay.
It is imperative that you condition your hair each time because if not, you're at risk for overly drying your scalp. So because you have short, coarse hair, I definitely recommend keeping up with the conditioning. Okay. So far, your hair itself appears healthy. Texture and type are normal for ethnicity. Hair length looks normal for your preference. Do you normally keep your hair short?
Yes, I do.
Okay. Regular signs of thinning around the border. That is natural. Your hair tends to be thinner around the hairline. Normal variation in curl pattern throughout. Hair is very thick, which is good. Not noticing any signs of male pattern balding, which is good. Just getting a sense for the overall texture. Do you have any pain or discomfort as I touch your hair or palpate your scalp?
No, not at all.
Okay, so I'm just going to feel around for any abnormalities. I want you to tell me if you experience any pain or discomfort, okay? Any kind of tenderness, especially at the back of the cranium. So we move closer to the temples. Or discomfort around the crown of the head.
No.
Okay. Are you experiencing any itchiness right now?
No, it's okay right now.
And when is the last time you washed your hair?
Yesterday.
Okay. Just getting a little bit of a closer look at your scalp. Very good. So overall, I'm mostly noting some mild signs of dandruff. You did just wash your hair yesterday, so I wouldn't expect it to be too bad as far as buildup, but I do see some visible flaking as well as redness in areas that I assume is where you've been scratching. So you do want to try to avoid that. I know it's difficult when your head is itchy, but it can just kind of further agitate the areas, which in turn makes it more itchy. So it's kind of a vicious cycle because you scratch it because it's itchy, but the more you scratch, the itchier it gets. So I would recommend using an anti-itch shampoo. I do have one today that I will be cleansing your scalp with, which should alleviate some of those symptoms. And I would follow up with that at least twice a week.
Okay.
And that should pretty much eradicate any itching. Because it doesn't look like any sort of dermatitis or folliculitis, which is an infection in the hair follicle itself. I'll do a little more testing with that later on when I test the integrity of your hair.
Okay.
But so far, I'm not seeing anything that's too concerning or that would require any sort of topical medication or anything like that, okay?
Okay, good.
So that is very good news. I do want to do a brief evaluation of your neurological sensations, just to make sure there's no abnormalities there. I'm going to be testing your ability to sense sharp, dull, cold, and a few other things on your scalp, okay? So let's go ahead and start with something soft. So I just have a Q-tip, kind of cotton applicator here. And I'm going to be giving you an example on your cheek. So can you tell me if and when you can feel this with your eyes closed?
Yes, I feel it.
Okay, and does that feel pretty soft to you?
Yes, it does.
Okay, so I'm going to be doing that on your scalp, and I want you to just say yes if you feel it.
Okay. Yes. 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 Yes.
Perfect. So I'm going to be using the opposite side, and this is a little sharper. So just an example on your cheek, say yes when you feel it.
Yes.
Very good. Now on your scalp.
Yes. 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 Yes.
Very good. And did that feel any different than any of the other areas?
No, I didn't.
Okay. So moving on from that, I'm going to test your sharp sensation. So I have a very sharp wheel here, again, testing on your cheek. Say yes when you feel it.
Yes.
Very good. I'm going to be very gently doing this along your scalp, and I want you to say yes, okay?
Okay. Yes. 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 Yes.
Very good. Now with this, I'm going to be running it along your scalp horizontally first, and I want you to tell me if it feels any different from one starting point to the end, okay?
All right.
So starting here, does any of this feel any different?
It feels mostly the same.
Mostly the
It might
same.
be a little more sensitive at the top.
Top here?
Yes.
Okay. So let's do that again, a little further back in the crown.
Yep. Same thing.
Same. So it's just more sensitive at the top.
Yes.
One more time.
That one felt the same all over.
All over, okay. So I'm going to run vertically now, and I want you to just do the same thing. Does this feel any different as I go down and back?
No, it doesn't.
And here.
No, it doesn't.
Here.
No.
Here.
No, the same.
And here.
Same.
So just slightly more sensitive here.
Yes.
Okay. So this was the area where you had a little bit of that redness and discoloration.
Okay.
You've been scratching here.
Right, I have.
Okay. So you have a little bit broken skin there, and that's why it's just a little tender. So we'll be mindful of that and be careful with that area. I have some oil that I'll be applying at the end, which will help soothe your scalp and heal some of those tender areas for you, okay?
All right.
So I want to go ahead and do one more sensation test. I have a point tool here. So I want to see if you're able to tell the difference between these two sensations. So this would be considered 1, and this would be considered 2.
Okay.
Can you tell the difference?
Barely.
So 1 is more of a pinpoint, and 1 has a larger surface area.
Okay.
So this is 1, and this is 2.
Okay, I see.
So I'll touch you with both ends, and you just tell me if you feel 1 or 2. Okay?
All right, 1, 2.
Very good.
1, 2, 2, 2, 1, 1, 2, 2, 1, 2, 2, 1, 1.
Very good. No discrepancies with that. Okay. So before we move on, I want to test the integrity of your hair while it's dry. Hair does become significantly weaker when it's wet. I will be repeating this test as it's wet during the wash as well as afterwards.
Okay.
But I want to do a preliminary test while it's dry so I can get a baseline of the strength of your hair, the cuticle, the follicle. So I'm going to be separating your hair out here into just a little section. And I have clip that I'll use to keep it separated. Basically gonna grab some of your hair with my comb and stretch it from root to tip. Just gently tugging on the hair follicle as I pull it. Is this causing you any pain or discomfort?
No, it's not.
Essentially, I'm just testing the strength of your hair. If you had weakened hair follicles or hair shafts, the hair would be pulling out of the follicle as I tug, but I'm not seeing that. So showing healthy signs of hair strength, which is very good. Okay. So I'm not noticing any discrepancies there. Okay, so the next thing I want to do is a scalp treatment because you are having the dandruff, and especially with the not so much open, but I would say discolored areas, we want to go ahead and do a scalp treatment on you today. So I am going to mist your hair to get it a little damp. Okay. This might be slightly cold. It is very fine mist. Is that okay?
That's fine.
I'm just going to press the water very slightly into your hair. Okay. So let's go ahead and apply the treatment. This is in the form of a shower cap, and I'm going to have you lift your head for me. Do you feel that at the base of your scalp?
Yes.
Okay, go ahead and lower your head. And pull this all the way up. It's a little cold. Okay. There are ingredients in this cap that are going to help with inflammation, alleviate some of that redness. This is also a pre-shampoo, so it's beginning the cleansing process before we apply the medicated shampoo. So I'll just be rubbing this in. If at any point this is uncomfortable, just let me know. I also have a tool that I'll be using to help further penetrate the scalp. Does this feel okay so far, James?
Yes, it does.
So I'm going to be using this vibratory tool to help further push the product into your scalp. Specifically in these areas that appear to be red and inflamed. that feel okay?
Yes, it does.
Okay. Let me know if I'm applying too much pressure. Extend this forward a little bit. And if you run this along your hairline, this also helps stimulate the hair follicle, increases blood flow to the area, which allows for increased hair growth production. So generally in men, hair loss tends to start with a receding hairline. So a tool like this can help re-stimulate those cells that generate hair growth and basically reactivate them, allowing for those reproductive cells to kind of wake up and remind them to continue growing your hair. Basically what happens is with age, these cells die off and stop producing hair. So your follicle is still intact, but the hair is just no longer growing. You don't have that issue just yet, but it doesn't hurt to do some preventative care while we're here. Okay. Okay, so it's been a couple of minutes. We can go ahead and remove this. I will have you lift your head for me. Very good, and go ahead and relax. So I'm going to re-wet your hair with our spray bottle and begin the cleansing process. So cold mist. Can I have you lift your head for me? Okay, go ahead and relax. So I have a clinical strength shampoo, and this is going to help treat your dandruff as well as treat the itchiness, the inflammation. This has several different ingredients in it, but the active ingredient does help fight dandruff. So when you're home and you're shampooing your hair, it's important to activate the ingredients in your shampoo. So you want to take a second to rub it between your palms before applying it to your head. And then once you do that, you can go ahead and start applying. I like to start at the hairline. And what I find with the majority of my patients is they're not actually washing their hair for long enough. So you want to almost overwash, especially if you're only washing once or twice a week, to ensure that you're really getting to the base and getting off those dead skin cells that are caused by the dandruff. It might be a little easier for you because you have shorter hair. And you never want to use your fingernails, always your fingertips. It's been okay so far.
Yes, it is.
So I can have you lift your head for me. I'm going to support your head with one of my hands and continue washing. Excuse me while I just get a little bit more shampoo. Go ahead and relax for just a second. Go ahead and relax your head. So I'm going to use this scalp brush to help further penetrate the shampoo into your scalp. Let me know if this is uncomfortable or painful. You might be experiencing a tingly feeling, and there is menthol in the shampoo, so that's totally normal.
Okay.
I would say overall, the shampooing process should take anywhere from 3 to 5 minutes. Any less than that and you're not washing your hair thoroughly enough, any more than that and you're probably overwashing, which can lead to a drier scalp. Do you think you fall somewhere in that range?
I believe I do, yeah.
Okay. Just adding a little more water. Okay, now if you lift your head for me one more time. Okay, go ahead and relax. I'm just going to have a look at your scalp, specifically these areas that were a little more concerning. And it does look like we were able to remove those visible flakes, and the redness has subsided. Okay, so what I would like you to do is head over to the washing bowl. Let's go ahead and rinse out the cleanser, and then I'll have you return to the bed here and we'll get you conditioned, okay?
Okay.
Okay. All right, James, let's go ahead and move on to the next step. Now that your hair has been thoroughly washed, I want to go ahead and apply a medicated conditioner. So I'm going to open up this pack and a little brush here that I'll be applying it with. while that sits on your hairline, I'm going to add a little water to your hair just to help you rehydrate. I can have you lift your head for me. Okay, you can go ahead and relax your head. Essentially, this is going to act as a leave-in conditioner. So it'll help to continuously rehydrate your hair until the next time you wash. So I just have a wet comb here, which is a comb that's safe for wet hair. It's going to help me to distribute this a little bit better. Okay, lift your head for me. Okay, you can relax. Now I'm going to be applying a deep conditioning mask, and this will be providing essential nutrients back into your hair. So go ahead and lift your head for me. Okay, you can relax your head down. Just pushing the product into your scalp. This is also helping to seal the follicle. Going back in with that vibration tool. feel okay? This is a warming cap. Are you feeling the warming sensation?
Yes, I am.
Okay. If it gets too hot, please let me know.
Sure.
Just making sure this is evenly distributed. This is a medicated cap, so we want to make sure all of that medication is penetrating your scalp. Okay, so if you'll just lift your head for just a second. Okay, so I am going to go ahead and let this sit on your head. I do want the medication to fully penetrate before we remove it. So if you're okay, I'm going to have you sit for about 10 minutes.
Okay.
And I will come back and remove it, and then I'm going to evaluate your scalp to make sure that we were successful in removing any of your irritation today, okay?
Okay.
Okay. So I will be back in 10 minutes. If you need me, please push your call button.
Okay.
Okay, thank you. All right, James, it's been about 10 minutes. Are you feeling okay?
Yes, I am.
Okay, so I am going to go ahead and remove the medication. If I can have you lift your head for me. Very good. I'm going to hold your head up for just a second. Just want to redistribute any of the excess product here. Okay, you can go ahead and relax your head. Very good. Just having one last look at your scalp. Are you feeling any better as far as the irritation or the itchiness? Are you feeling any relief?
Yes, I do feel relief.
Okay, perfect. Okay. So your scalp is looking much better. Any signs of flaking or irritation are gone at this point. So looks like we had a successful treatment. The last thing I'm going to do is just go in with my massage brush here and just help redistribute any of that leftover product. Lift your head one more time for me. can go ahead and relax, and I am going to go ahead and finalize your scalp exam by applying an oil to your scalp. So this is actually an all-natural product. It's Jamaican black castor oil, and I highly recommend incorporating this into your everyday routine.
Okay.
Have you ever used black castor oil before?
No, I don't think so.
Okay. So it's very thick and viscous. It almost has the consistency of honey. And it is safe to leave in your hair for an extended period of time. So I'm going to be applying this kind of all over, but specifically to the area that we noticed was more irritated. And obviously it's an oil, so it will feel slightly oily and sticky, but if you'd like, you can wash it out. I would at least wait one day.
Okay.
So if you can wait until tomorrow, that would be good, just so it fully penetrates the scalp. And this can be something that you incorporate in your routine maybe once a week. It's an easy thing to apply at night and leave in overnight and wash out in the morning. I do recommend wearing either a bonnet or a shower cap before you go to bed, just so you're not getting it all over your linen.
Okay.
I'm just taking a comb. The last thing I'm going to be doing for your scalp exam is retesting the strength of your hair. So we did this test when your hair was dry. And now that it's damp and clean, I just want to retest. So again, just stretching the hair from root to tip. Any pain or discomfort with any of this?
No.
All of that looks healthy. I think we should go ahead and move on to the skin exam portion of your visit today, if that's all right.
Sure, that's fine.
Okay. So just allow me to change out my gloves and then I'll have a look at your face, okay?
Okay.
All right, James. So if I could have you just slightly tilt your head back in a manner that's still comfortable for you.
Sure.
Okay. I'm going to be having a look at your face.
Okay.
So starting off with a visual inspection. Are there any areas in particular that you're concerned with, or is this just an overall checkup?
It's just an overall checkup.
Okay. So just having a look at the overall integrity of your skin. Noting any possible abnormalities. I'm seeing a little bit of dryness in between the brow, as well as some slight congestion at the bridge of your nose. Maybe some dryness on the forehead as well. Okay. How well do you stay hydrated?
Very hydrated.
Okay. Just gonna start off by doing some percussions of your face. You don't have to do anything. Just testing for strength and elasticity of your skin. Elasticities tends to diminish over time, so I just want to see how well your skin is doing. Let me know if any of this causes you any pain. Basically what I'm doing is manipulating your skin in different directions and then releasing and seeing how quickly your skin moves back to its natural state, which helps me determine whether or not your skin is lacking something or just how well it's doing overall. Can you open your eyes for me for 1 second? Okay, you can go ahead and close. Thank you. So I'm going to be doing a sensation test on your face, similar to what we did on your scalp. So I'll be rubbing 2 objects on your face. They're both going to be soft. Here's an example. Say yes if you feel it.
Yes.
Okay. So I'm going to repeat this test on different areas of your face, okay?
Yes. 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 Yes.
Okay. So I'm going to do that again. This time I want you to tell me if you feel 1 or 2.
Okay. 2. 1. 1. 2. 2. 1.
Going back to the first test, this time you're going to feel something sharp, so say yes if you feel this.
Yes.
Okay.
Yes. 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 Yes.
Very good. Tell me if you feel one or two.
One. One. Two. 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 One. Two. Two. One.
Very good. Okay. Let's move on to your sharp sensation. Going back to that same wheel, I want you to tell me if you can feel this.
Yes.
Okay. So I'm going to run this along various portions of your face, and I want you to just tell me if it feels different in any place compared to the other, okay?
Okay.
So does this feel the same or similar to this?
Yes, it does.
And this and this?
Yes.
We do kind of horizontal here and here.
Yes.
The sides of your nose.
Yep.
We do chin
Yes.
here, top and bottom,
Yes.
your nose, your forehead.
Yes.
All of this feels pretty much the same.
Yes, it does.
No loss of sensation, numbness, tingling, pain, anything like that, correct?
No, nothing like that.
Okay, perfect. Okay, so let's go ahead and move on. I want to go ahead and start by cleansing your skin so that we can work on some extractions. You do have some congestion around your nose that I would like to clean up, but we need to start with a clean base layer. So if that's all right with you, I'm going to go ahead and clean your face.
Okay.
All right, James, so I'm going to have you keep your eyes closed, and I will be misting over your face. You're going to feel a cold mist. Just keep your eyes closed for me, okay?
All right.
Very good. I'm going to start by applying our first cleanser, which is an exfoliating wash. This is a rice cleanser, and the rice is going to help rehydrate your skin. So you're going to feel my fingers touching you. Essentially, I'm working this into the skin, making sure we deeply penetrate all areas, removing any excess debris or dead skin cells. And this will also help with the extraction process. Just going in with a little more water. Please keep your eyes closed. So to that, I'm going to add a charcoal pad cleanser. So give me just 1 second to get this set up. So you're going to feel me touching your face. And this product contains naturally derived activated charcoal. It also acts as an exfoliator. Helping us to get into any small, more difficult to reach areas, as well as helping to loosen up any of that bacteria that may be under the surface of the skin. Doing okay so far, James?
Yes.
Okay. So we got this pretty well worked done. What I'm going to do is use the mitt to just remove some of the excess cleanser. I have a couple dry cotton pads here. I'm going to help remove some of this cleanser before we rinse your face. Okay, I'm going to stain your face once again, eyes closed. Going in with 2 damp cloths. Alright, James, if I could just have you look up for me for just a second. Okay. Go ahead and close your eyes. We're all done with the cleansing process. So I'm just going to give your skin a second to relax. Alright, James, let's go ahead and move on to the next step. Next thing I'm going to do is tone your face. This is a glycolic acid toner. So I'm going to be misting your face with a thermal spray. So keep your eyes closed for me. And this is just going to help protect your skin from the glycolic acid so that it's not too strong. Glycolic acid is a chemical exfoliant, and the thermal spring water will just help your skin from getting too dry. Let's go ahead and let that sit for just a second. The next thing I'm going to be applying is a moisturizing serum. This is kept in the refrigerator, so it is going to be very cold. Using the heat of my fingers to gently press this into the skin. Okay. So while that's sitting on your face, I'm going to go ahead and apply a moisturizing cream. It's a very cold cream. This is a ceramide cream, so it's going to go ahead and help replenish all of those healthy ceramides that keep your skin looking youthful. I'm going to let that sit for just a second. While I go ahead and apply my loops. Okay. I have my loops on, and I'm going to be having a deeper look at your nose, as well as a few other areas, just checking for some of that congestion. So just go ahead and relax. Let me know if any of this causes you any discomfort. Just removing any of the more obvious signs of congestion. Doing really well. We're almost done with the extractions. I'm not seeing too many. Very good. Just having a look over a few areas here. But for the most part, I think we got all of them out. It's normal to have congestion around the nose. It's a more difficult area to wash, so people tend to have blackheads, which essentially are small white heads that have been exposed to oxygen. Okay. So have you just turn your face slightly for me? Thank you. Just having a look over here. I'm not seeing anything really on the side of your face, which is good. Okay. Alright, James, we are all done with the extraction portion of the exam. So what I'd like to do now is apply a hydrating mask to your face. Since we did just irritate a few areas, I would like to go ahead and rehydrate before I send you home. So I have a 2-part mask here. And it's probably going to feel a little bit odd. Excuse me while I place that on your shirt. Okay, so this is going to be very, very cold. Please keep your eyes closed. I will readjust as I put it on. So I'm going to go ahead and apply the bottom portion of the mask. We're trying to cover as much surface area as we can. So while that sits on your face, I'm going to reintroduce a couple different vibratory agents, and these are going to help penetrate the product into your skin. Okay. So you should just feel a cold pressure. You doing okay?
Yes.
So the good news is I wasn't noticing any signs of skin cancer or what we would call a melanoma. You don't have any oddly shaped moles on your face or anything that would be of more serious concern. Just gently pushing this into your skin before we remove it. The last thing I'm going to do while you're wearing the mask is a little bit of vibration therapy. Can you feel that? Just introducing different frequencies into the skin. To hopefully help increase the blood flow. Increase collagen production. and remove this. And just having a last look at that skin elasticity. It does seem to have improved. Open your eyes for me. Very good. Okay. All right, James. Your skin is looking a lot better. Like I said, I didn't notice anything as far as skin cancer. You have the one mole on your nose, but it does appear to be normal in margins. It's round, symmetrical. It's not raised or abnormally colored. You don't have any signs or symptoms of hair loss in your scalp or beard. Eyelashes and eyebrows look healthy. You did have some congestion around your nose, but we took care of that today. Obviously, always recommend wearing a sunscreen every single day. Even if you don't go outside, if you're on a long drive, you're exposed to the sun, or if you're sitting near a window, that kind of thing, you just want to be cautious. Also recommend wearing a chapstick that contains sunscreen. A lot of people forget to protect their lips from the sun. And then as we discussed with your hair, obviously you want to make sure you're using the dandruff shampoo at least twice a week. If you notice any excess signs of irritation or any kind of discharge or excessive flaking, obviously you can come back. But until then, I think you're in good shape. And I'm just going to go ahead and comb through your eyebrows. So I did move them around a little bit. Other than that, I would say you are good to go. I am giving you a clean bill of health. I would like to see you again in 1 year to do a repeat skin examination just as a precaution. And as long as you keep up with everything we discussed today, I think you'll be okay.
All right.
All right. Well, I will go ahead and let you get out of here. I'm going to clean up, and you can pre-schedule that appointment if you'd like at the receptionist desk. If not, you can call us in about a year's time and we'll get that scheduled for you, okay?
All right. Thank you.
Thank you so much. Take care.
Sure.